Hello, my name is Angela Beckerman. I am a licensed psychotherapist and addiction specialist. Today in this video, we're going to address how and why addiction has become a crisis that has led to opiate overdoses and deaths. There have many factors that have contributed to this. First, individuals and communities do not understand addiction and how it develops. People don't always recognize the symptoms and warning signs of addiction. People are unaware of community prevention and treatment counseling interventions. The one thing I want to emphasize is that no one is to blame for addiction. No one plans or wants to become addicted. And people who become addicted once were healthy financially and had employment stability, had good functional relationships, and were working on their personal goals. As citizens and professionals in the community, we can address addiction in an educated, non-judgmental, and empathetic way. Addiction is not bad, unlawful behavior of the immoral and uneducated poor that should be punished. Rather, drug use is often unintentional behavior resulting from physical, emotional, and behavioral symptoms of an unforeseen disease. Many people who become addicted would have never stolen, prostituted, assaulted others, or put themselves or families at risk if they did not have the compelling urges of their physical dependency. Today, in this video, we're going to address how addiction can progress over time. And in the next video, part 2, I will be discussing how we can stop the progression of addiction in our families and communities. First, I want to address how drug use affects the individual. Although people can get high and feel good from drug use, it can cause significant anxiety, depression, anger, and mood swings. It can cause cognitive impairments, poor concentration, poor memory, lack of judgment, and lack of coordination. Behaviorally, people can act impulsively or aggressively or isolate from others. Along with affecting the individual, addiction can also affect families. Due to the costs of illicit drugs, it can cause financial problems and marital conflict, divorce, battle custody of children, neglect and abuse of children, and children growing into adults who have emotional problems and addiction issues. In the community, addiction can increase crime rates as there are arrests for possession, selling, trespassing, and assaults, and burglary and other such arrests. It can also cause domestic violence, hunger, and homelessness, along with poverty. Nationally, it can cause problems in the economy. Mortality rates, higher medical costs, higher costs for medical insurance. It can be sometimes hard to recognize addiction because of tolerance. Tolerance is when someone uses drugs. Over time, they increase it in frequency, amount, and duration of time. The body becomes physically addicted, and the person relies on the substance. If someone tries to stop using, they can experience emotional and physical withdrawal, which includes anxiety, depression, anger, hallucinations, delusions, also seizures, and possible death. Along with these physical withdrawals, addiction can have other medical physical consequences, such as organ damage. Alcohol causes liver cirrhosis and pancreatitis. Continued cocaine use can cause cardiac problems. Along with physical dependency, there's emotional dependency with drug addiction. Drug-dependent people are often fearful of stopping their use because they do not know how to cope with negative feelings and the stressors in their life. They may use drugs in order to deal with their anxiety, depression, mood swings, anger. They use substances because they do not know how to deal with life stressors, which could be health problems, pain, financial and employment problems, relationship difficulties, past trauma, unachieved goals, and low self-esteem. People often ask, if someone has addiction and emotional issues, what comes first? Or what came first? If someone has had long-term anxiety and depression, they may learn to use drugs to self-medicate themselves, and they become addicted. People who have legitimate pain for medical conditions or bodily injury also become addicted to substances. People with addiction, over time, with continued use, it can affect their brain, and there could be chemical changes in the brain that affects their moods, where they have increased anxiety, depression, and anger. So whether you had emotional issues and then you became an addict, or you were an addict and then had emotional problems, you have two disorders and are one of many of the co-occurring population. Sometimes people become addicted to illicit substances because they stop their medications. There are medications such as benzodiazepine and opiates that are addictive in nature and are controlled substances. For example, people with anxiety who are prescribed anti-anxiety medications such as benzodiazepine, of Ativan, Xanax, and Klonopin may use it and take it as prescribed, but over time, with tolerance, they use it more in frequency and amount, more than prescribed, and they abuse it. When their medication stops, they seek it illicitly. Same thing with people with pain, where they are prescribed opiate medications such as Vicodin, Percocets, or Oxycontin, and they use it as prescribed, and then over time they abuse it because of tolerance. They increase it more in amount and frequency than prescribed, and then when their prescription is stopped, they seek it illicitly. This video has addressed how addiction can develop and progress over time, and how it can affect individuals, families, and communities. The next video, part 2, will discuss how individuals, families, and communities can stop the progression of addiction. I hope you've learned from this video. I hope you observe and listen to the next video. I hope you have enjoyed this. Feel free to share your experiences or provide suggestions, but be aware that this is a public forum. Thank you, and have a nice day.